We'll get started because we want to be mindful of everyone's time. So welcome, and as you start maybe filtering in, um, we'll get going here. But I have a lot of thoughts, and but really, what I want to talk about is kind of the focus and the opportunity for this evening. It's obviously been a very dramatic few days and dramatic week, and we have a lot of focus on schools, which is good. They are essential and should be part of the dialogue locally and nationally, so that is all good. But a few things that I wanted to open up by saying is, number one, for whatever is about to happen this year, we as a school, as a community, as teachers and educators are prepared. And this is going to be a year to really ask us to pivot and change to the needs of the moment and the needs of our community. And we may not be able to offer a million options, but there will be a wholeness to what we will deliver, which is the Sea Crest education that you chose to send your children to, and that you chose to be part of. And I know the mission behind it, and that you believe in. And so, while there's a lot of moving pieces, I want to assure you as much as I can that we are prepared for various scenarios, even though they are changing by the minute and by the hour. So the focus of tonight is this amazing team of fellow parents and Sea Crest community members and experts in their field reached out to me and said, I see that the school is having to kind of read through giant guidebooks and navigate through various things that we aren't normally well versed in. And they work in a field of expertise and offer to give their opinion and support for us, not only for us in terms of if and when we could open the school, but also as an opportunity for us as a community to utilize those that know more about what is going on. So it's a huge opportunity for us as parents and as educators and as just humans living through COVID, to ask our questions. No question too small or too simplistic. And we got a lot of questions, I should say that. So we are not skewing this panel towards opening school versus not opening at school. We are really going to be talking about what COVID is and answer as many questions. We will answer some questions as it pertains to schools, whether it's something that does happen in the next few weeks or when we can open schools, because innately there is more of a risk attached and more questions attached to if students are learning in person versus at home. So there will be more questions about that. Every panelist has their own background, and we will do a quick round robin of introduction, and they have their professional opinion, and then at the end they'll have their personal feelings and opinion as a member of the community and as a parent as well. And so I know that there's a lot of interest, and we got a lot of questions about distance learning. I will touch on that very briefly at the end, but this panel was set up for this kind of interactive question and answer for our families and communities as a service. So we're gonna just go around really quick, and we're gonna introduce ourselves, do our high-level background, and then we're gonna jump into the questions. We got all of your questions. We categorized them, and I tried to take out specifics to individuals and make it more broad for the greater community. There is the chat feature if we don't touch on something that you feel is really critically important. Okay, so hopefully I know all of you virtually because I've never met any of you in person, but I'm Lauren Miller and the new head of Sea Crest School. And at my screen, Keely is the next.
Thanks. Hi, Keely Rawlings. I'm a licensed clinical psychologist with a practice here in Half Moon Bay and in Los Altos. This will be our 17th year at Sea Crest, 17th and final. We have a 21-year-old, an 18-year-old, and an 8th grader.
And then I have Karen to the right of me.
Hi, I'm Karen Wang. My daughter will be coming in as a JK student this year. I have a PhD in applied economics and a master's in environmental science, and I work in environmental health. Yep.
Great. Roxana.
Hi, I'm Roxana Arani. My daughter Talia will be coming in to JK and my son Duncan will be coming into 3rd grade. I'm a physician at UCSF and I also have a PhD in biochemistry. I'm also the executive medical director for women's health at UCSF, so I've been intimately involved in reopening our clinics and getting our patients and staff back in there safe.
Wonderful. Lee.
Hi, nice to meet all of you. My name is Lee Swim. I'm the father of Bobby and Haley. They're going into 7th grade. And I'm an infectious disease researcher, have been for a number of years now, probably 20 years. I've been studying microbes and viruses in various fashions in both academia and industry. Started and led the influenza program at Genentech that was actually focused on pandemic preparedness and treating severe flu patients with monoclonal antibodies. And just recently started a new microbiome company. Nice to meet all of you. Look forward to the questions.
Wonderful. And Hannah. Hope you're muted.
I have to get used to that. Nice to meet you all. I'm Hannah Walford. I'm mom to Will, who's an incoming junior kindergartner, and we also have a 2-year-old. And I'm a physician at an outpatient Stanford affiliated clinic, Menlo Medical Clinic, where I'm an allergist and clinical immunologist. So it's nice to meet you all.
Wonderful. Okay, we're gonna dive right into the questions that were pre-submitted. And I'm just gonna mention one more time, we really try to consolidate these and streamline them. So, and they're not in any particular order as far as for any reason, just they're in the order they are. So the first questions really came in about surface transmission and cleaning. So questions around speak to surface transmissions and disinfecting and cleaning protocols and products. And then a lot of follow-up questions on, do we need to be wiping down all our groceries? Should we be wearing gloves? There was at one point a rumor that we should take our mail out and leave it out in the sun first. And then the follow-up to that would be around the school and disinfecting and the playground and things like that. I'm going to start off with Karen. Karen's actually been working with the team prior to me even starting at Sea Crest, guiding as we started beginning looking at what resources, if and when we are able to open, would be the safest and the best for cleaning and disinfecting supplies. And I know she has a lot of expertise in the transmission area. So we'll start with her, but the other panelists will join in as well.
Okay, should I share the slides?
Sure.
Oh, it says host disabled attendee screen sharing.
Oh, let's see if we can, I think we could get Andrew to, oh, you're now the host.
Oh, okay. Let's see, I think it's, okay. How do I make this? Sorry. Okay. So great, thank you so much. So this is just some research showing how stable the virus SARS-CoV-2 that is causing the current pandemic is on surfaces. And you'll see that, you know, on surfaces like paper and tissue paper, it's porous surfaces, very quickly the virus is deactivated. And there are studies showing that it could be infective on surfaces all the way up to about 7 days. However, you know, all of those studies were done in labs where they, you know, very tightly controlled humidity, the temperature, they were indoors. There's also the question of how much virus particle needs to be on a surface for it to be then, if you touched or someone touched an infected surface and then touched your nose or mouth, how much that would be. And the research on this is pretty preliminary. However, what we're seeing is that the chance of transmission is very small, especially in non-hospital settings. Although theoretically it is possible. It's, you know, researchers are looking at this through a lot of the contact tracing studies. There hasn't really been any evidence that a contaminated surface was the reason that somebody then got the virus. And if you think about it, somebody would need to, you know, sneeze or cough or sing all over a surface. Within probably a couple hours, somebody else would then have to touch it and then touch their hand, nose, and mouth. So basically, you know, the guidance right now is that the #1 thing we can do about it is proper hand hygiene. So hand washing for at least 20 seconds. If that's not possible, hand sanitizer. And to also clean and disinfect surfaces, not every inch of every room, that's not practical and not necessarily necessary or cost efficient, but surfaces that people touch a lot. So light switches, doorknobs, faucet handles, things like that. So, you know, we've been talking with Sea Crest about how to clean and disinfect properly, and I've worked with them on their cleaning protocol. And I think that what they have in place is definitely really great. So one thing is that surfaces should be cleaned before disinfecting. If a surface is dirty with, let's say, grease from someone's hands or dirt, it can cause disinfectants to not actually work. So that's part of the protocol, is that, you know, things are first cleaned, and that actually can remove virus particles before the disinfectant is applied, which then kills whatever is, or just deactivates whatever is left. We talked a lot about like contact times. Different disinfectant products have different contact times. So either 1 minute or, you know, 10 minutes, preferably, since, you know, the whole school is being cleaned and maybe even in between, we would like these contact times to be short. So we've chosen products where the contact time is more reasonable, 1 to 2 minutes versus like having the surface be wet for 10 minutes. We've also chosen products that do not have other harmful health effects. So, you know, actually California reopening guidelines specify that the active ingredients in disinfectants are what's listed here: hydrogen peroxide, lactic acid, or citric acid, to reduce risk of causing or triggering asthma. So some disinfectants like bleach or other quat-based disinfectants, especially in the for younger children, could have a health risk. Another thing we talked about is disinfectants don't work on porous objects. So don't disinfect books. You can't disinfect pillows or stuffies. Likewise, you can't disinfect like a cardboard box of pasta. So this applies to your groceries as well. You know, as the other slide showed, the virus actually doesn't stay very active on porous objects anyways. And then Sea Crest has been advised to remove like unnecessary porous objects, so that, you know, kids aren't, you know, like putting their faces in the same pillow or something if that pillow doesn't need to be there. So, I think that, we've done a very careful job of looking at how often high touch surfaces are going to be disinfected throughout the day. They're also going to be disinfected at night. In regards to the playground question, because I know that's come up, it doesn't really make sense to disinfect an entire playground, nor is it, I think really that necessary. If you remember, I think what we have currently is that like very high touch surfaces would be wiped down and disinfected like a handrail. But it's not necessary to disinfect the entire playground. I think that we'll talk about this more, but that gets more to like limiting the group that's on the play structure at a certain time on a certain day. And we have to remember that, weather, sun, rain, all of that will help deactivate the virus if there is any. And the likelihood that there would be so much virus on a particular bit of the outdoor playground to get somebody else sick is quite low. What was groceries? What we tell people is that, you should be washing your fruits and vegetables with soap and water, or just washing them anyways. So please do that. It's not necessary to disinfect every package that comes through. If, however, you are very sensitive or immunocompromised, you have grandparents with you, you can leave groceries for a day or 2 days in non-perishable groceries, just in the bag, and then they should be good to go. And for perishable things that you're putting in the fridge, you could wipe them down, but it's really not necessary. What would be more necessary is that you should be washing your hands before you prepare food, before you eat food, and after as well. So, Lauren, did I cover all the surface transmission questions?
You covered all of them.
Okay.
Okay, so next main topic of questions are kind of what ifs, and these are a lot larger. We really condensed them into 3. A lot of you had really specific, amazing what ifs, and if we don't answer it in this setting, email me back. I'll send it to the team and let them kind of answer our very, very detailed, specific what ifs. So the first question is about children getting COVID. As kind of rising numbers are increasing in all of the areas around us, there is a chance that children will start getting COVID, really looking at kind of long-term effects. And is there any information? We're really early on in this virus, and obviously we don't know the long-term effects in terms of it hasn't been a long time since it's been here, but could anyone speak to kind of initial thoughts or feelings about COVID if and when one of our children should get it?
I can speak to that if you'd like. So first of all, in general, kids, from the peer review data that we have, I know there's been a lot of new stuff in the news that has not yet been peer reviewed, but from the good journals that we have in strong evidence-based medicine, we know that kids don't, get COVID-19 as readily as adults do. When they do get it, it's less severe of a condition. And we also know that in general, they don't transmit as readily as adults do. And I can go into the mechanism of why that is a little bit if you'd like, but in general, again, we don't have a lot of long-term studies about that because we've only known about this virus for about 7 months. So I can't tell you that if your kid gets it now, what does that mean for them in their 40s? What we do know is that they don't get as sick when they do get it. And then when we talk about hospitalizations, in the United States, first of all, kids represent less than 2% of all COVID infections in the United States. And when we talk about hospitalizations, when we do that in the metric of out of 100,000. So if a kid was to become positive with COVID-19, 0.1 kids out of 100,000 positive kids would go into the hospital. And that's in contrast with 7.4 adults out of 100,000. So there's a big difference in the amount of even hospitalizations that kids get. And when we talk about, the terrible complication of this multi-inflammatory disorder of children, when you hear about the Kawasaki's condition in children, there's only been, about 156 cases. So, not even 200 cases in all of the children in the United States. And so we don't base our guidelines based on that terrible complication that's extremely rare. So that kind of, I should hope, frames a little bit about kind of this disease in kids. Does that answer all that, Lauren?
I think so.
Okay.
Does anyone else have anything to add about long-term complications possibly in kids? I know it's a little uncharted and unknown.
The only thing that I would add, Lauren, is just, I think that everyone's well aware of the increased anxiety and depression among the adult and the child population. So just being aware that this is a really unusual time of uncertainty and loss, and being open to talking to your kids about that and what their experiences.
Okay, thank you. So the other what ifs in more of a general sense is for those that may become exposed to COVID, what do you recommend is the safest next steps? And I know that that's a hard generic question, and we got a lot of variations on it. Like if my child, someone that they like saw at the beach got exposed versus like if they were in your house. And so I know it's really hard to touch on that exposure because it is really situational, but for all intensive purposes, say someone you interacted with, maybe you didn't hug them, but you interacted with, calls you and says, I was exposed. What is the next step and what do we do?
I can speak to that, and I'm sure the other physicians on the panel can as well. I think generally the protocol is if you think you've been exposed, you should you can get tested, and that's pretty widely available now at a variety of drive-in clinics. So you could contact your primary care physician or pediatrician, and that's pretty easy to set up. So they often will put in the order over a video visit or over a telephone call, and then you can just drive and get the nasal swab. If you don't want to bring your child for testing, then the advice is generally to self-quarantine for 14 days, in the event you were to develop symptoms. Typically, those symptoms would develop in 7 to 10 days. And then, so that's generally the advice if anybody at home comes down sick or you think you were exposed. Does that answer the question?
I think so. I think,
can I just add that,
we got
like when we,
very situational.
Yeah,
exactly.
Can I just add that, the CDC defines like a high risk exposure is when you're within 6 feet of somebody for over 15 minutes without any PPE on of a positive person. So that defines like a high risk exposure versus a close contact. So if you have a high risk exposure, there should be no question you should get tested. But if you have a close contact exposure, meaning that you exactly what Hannah described, like just, in passing, and you heard of somebody that you were in contact with that had it, then you could certainly also get tested. But I would 100% recommending testing and not an option if you have a high risk exposure.
And I guess my follow-up question is, at what point do we worry about exposures? Like, for example, if my husband, is on the coastal trail and like sees someone passing and then they say, oh, I was exposed. And then he comes home and is like, well, now you're exposed and our kids, like, at what point do we just monitor our symptoms? Like, I think that there's a lot of concerns, not only with schools, but in all of us, as we start knowing more and more people that become exposed as opposed to actively have it. At what point do we kind of panic or engage in what should we do next?
I think with the scenario you just described, with exposure outdoors, we know the transmission rate is really low. It's probably inactivated very rapidly with UV light. So you would have to, like Roxana said, have to have very close contact with somebody who was symptomatic or a positive case, I think, to raise that level of concern for testing. I think these scenarios where there was somebody who might have had symptoms and you're talking about, 6 degrees of separation, I think that's very unlikely.
Agreed.
So the last question we had in this series that came up repeatedly, and like I said, there were lots of other questions, but we tried to stick to those that were most in the same vein, was that if someone in your family has symptoms, say one of the adults, should you immediately, and you have to go get tested and then you have to wait the time to get the test back, like should you immediately try to quarantine your children and the rest of the family away from them within your own house?
Yes, ideally. That's it's not something that's easy to do because we are all unmasked in our own homes. But the chance of spread is higher if somebody's symptomatic and coughing and sneezing, because those droplets then go farther, and then they have more virus in them. And so that increases the chance of transmission. So if you can quarantine within your own home, great, and ideal.
Yeah, and I think when it comes to taking care of your own children, like obviously that's harder, but just, simple things, just like washing your hands a lot, not sharing food and drink, that sort of thing can go a far way.
And even just masking can help too. I've had several friends who have been positive, and they simply mask in their own home, and a lot of hand hygiene, and it's great modeling for their kids as well.
Speaking of masking, our next questions that were pre-provided were about masks. So the first big question is that came up to a little bit of debate, and it's interesting asking a panel of scientists and doctors about mask wear, because I know it's part of the job. But for us layman folk walking around, are masks safe? Are masks safe for kids to wear? Are masks safe for kids to wear all day? And let's talk about the biology and science behind it. And then Keely will talk to you a little bit more about maybe some of the other social emotional things attached to wearing a mask.
Can I share, or Karen, do you still have the slides that you can share? I just added a couple. If you want to go to the beginning of that.
Andrew took the hosts back, but
Andrew, if you want to share the
Oh, Karen, you're the host.
Wang, you're now the host. If you just want to go to the top there.
I think I still have it up. Okay.
Yeah.
Okay, here we go.
Great. Thank you. So, probably we should have even opened with this. And if you want to go to the first one, yeah, that's great. So, just when we think about how it's spread and why masking is so important, SARS-CoV-2, that's the actual virus, and we all colloquially call it COVID-19, but it spreads by droplet. And so what droplets are, like if you were to put your hand in front of your face right now, and when you're talking, you can feel a warmth and some moisture, and that warmth and moisture are droplets. And in general, those droplets don't stay in the air indefinitely. They're weighted and they fall, and generally they fall within about 6 feet. And that's where that 6-foot rule comes from. And for most adults, that's even far. Most actually end up falling at about 3 feet. And for kids, that's a lot less. And if you're being active and you're playing basketball or singing, that's going to be a lot more. But they don't stay aerosolized, they drop. And so when Karen was talking about, transmission from a surface, those droplets have to fall. They have to land on your computer or whatever surface. Then you have to touch that surface, and then you have to bring it in contact with your mucous membranes, the pink, moist skin on the inside of your nose and your mouth and your lungs, your eyes. And so when we mask, it blocks those droplets from transmission, not 100%. And so they stop a positive person from spreading and from you to inhaling for that virus to touch your nose and mouth. And for adults, you know, for the most part, there's no reason why an adult can't wear a mask all day. And even a kid with asthma, for example, there's no reason why they can't wear a mask for a prolonged amount of time either. And Karen, if you wouldn't mind going to the next slide, I just have a picture of masks that should not be used. So in general, you know, using these typical surgical masks with the gentleman with the face shield and the mask is great. But what's not great is using that bottom left kind of mask where there's that off valve. That is not safe and should not actually be permitted on campus, because those are what we call environmental masks. So, you know, painters might use those, or if you're in a dusty situation, you know, it stops particulates from going in, but it doesn't stop any of the virus from coming out. And so that is not a medical grade mask, and that does not protect the people around you. The best thing for you to do is obviously hand washing, but masking is so vital and important to stop droplet transmission.
Thank you so much. Haley, could you speak to kind of, in your opinion, about wearing a mask and kids wearing a mask? A lot of parents actually emailed in about that their kid has been resistant to wear a mask out in public or in different settings, and kind of what our next step should be when talking to our kids about wearing a mask, whether it's coming back to school or just, you know, going out for a walk or to the grocery store or something like that.
Yeah, you bet. Am I unmuted? Are we good? Yeah.
Yep.
I think one of the things that we need to be thinking about is clear communication. And so whether a kid comes back to school or not, talking to them about what COVID is, giving them an explanation, just like Roxana did, that's age appropriate about spread. You could have them breathe on their hand and feel the moisture. You can talk to them about what these droplets do. So having really good, clear communication with them about what COVID is, having clear communication with them about what physical distancing is, which is the term I prefer rather than social distancing, even though I think we've all gotten used to using the term social distancing, but talking to them about what physical distancing is, and then certainly mask wearing, and talking to them about the why and how it helps. You can have them put a mask on and maybe try to blow a candle out, take the mask off, blow the candle out, and you can talk to them about what the mask does is it keeps germs in if you have them, and it keeps germs out if someone else has them. And using some physical example, like breathing on your hand or blowing out a candle or attempting to blow out a candle. You hope and you want, by the way, if the mask is on, you want them to not be able to blow out the candle. If they can, they don't have a good mask. Then the other piece about mask wearing is if you haven't started now, you should absolutely start having your kids practice wearing a mask. Have them wear it around the house. If you're watching a movie and they're not talking, that might be a great place to start, because one of the most uncomfortable things about the mask is the talking part. It gets hot and kind of humid and sticky sometimes. So have them start with something that's really simple. So just watching a movie with the mask on. You want to teach them how to properly take the mask off. And then incrementally, like you would with teaching your kid how to ride a bike, right? You don't just put them out on the bike the first day. You have them go with training wheels, and then you hold the back seat for quite a while until they're ready to go. Incrementally, you would do the same thing with a mask. You have them maybe watch a movie with it, and you do that for a few days. And then you increase it up to maybe a 2-hour mask wear, and then a 2.5-hour mask wear, and then a 3-hour mask wear. So it's just getting them used to it. You should be wearing one when you're asking them to wear one. So if you're watching a family movie and you're training your child to wear a mask, you should be wearing a mask. And And then we talked about this as a health and wellness group last week. I think it's really important for faculty and staff to be thinking about how to prepare students about what around what it's going to look like to see your teacher and your fellow students in a mask. So there's a lot of anticipatory anxiety, right? What is school going to look like? Probably greater in older kids who have been to school more because they have an experience to look at and compare, maybe a little bit less for younger kids. But certainly for teachers to think about having a Google Classroom meeting or a Zoom meeting with their students before school starts so that students can see their face without a mask and then actually watch them mask. Maybe teachers can talk to students about the importance of masks as they mask up so the student can see the transition between unmasked teacher and masked teacher. There was a great Mr. Rogers segment on this when I was a kid where he met with a firefighter. And you watch the firefighter put on all of their gear so that if by chance a firefighter came into your home as a kid, you wouldn't be scared. You would know what to expect. It's the same principle. We want to reduce the anticipatory anxiety and help kids really understand what they're going to see when they get to the classroom, and potentially have teachers do a video of their classroom. What's the classroom going to look like when I get there? What does the hand washing station look like? So any way, and Lauren and I have talked about this, any way the school can help prepare kids around what to expect. And then most importantly, if any of you have ever heard me speak about child development and raising healthy kids, I think the most important thing is that I can reinforce is really good communication, making sure you are validating how your kids are feeling and hearing, listening for and asking about anxiety, depression, signs of stress, worries that they might have, and being able to communicate, invite that and being able to communicate with them about that and validating those experiences.
Thank you. So many good
Yeah, you bet.
things to think about around masks. I know it's a struggle for all of us, and as parents, and it's personally, I've been struggling having my kids keep them on. You turn around and they're off, and that's kind of a learned behavior that unfortunately in the times we're in, whether we want to go for a hike or to the store or possibly school, it is going to have to become more of a commonplace learned behavior. We had some questions about school specifically opening and risk and reward and things like that. But before we jump into that, we had a really interesting question, and there was a couple different scenarios that people brought up about businesses that have been currently operating since the start of the pandemic, be it the grocery store or various other organizations, hospitals, obviously, although those probably have their own specific circumstance around it. And like what you have seen in your expert opinion, once an organization has protocols in place, are we seeing a lot of, if there can be contract tracing, cases within those businesses, whether it's in your own hospitals or in the local grocery store or something like that?
Yeah, I can speak to that a little bit. So, I mean, when we're talking about from adult to adult or adult to child, it's a little bit different. But when we're talking about adult to adult, even in the hospital setting, for example, I know at UCSF, we have a very incredibly low rate. In fact, we've had no cases of patient-to-patient transmission on our units because we have such strict protocols in place. We've had very few cases of healthcare workers even becoming positive in the workplace, and usually it's because of breach of protocol. And, I think one of the things when we think about kids, we can look to the camps and how well we've done in the Bay Area. We have yet to publish the data, but it's being looked at right now. And I think that the data in the Bay Area is incredibly reassuring when we think about transmission from kid to kid or adult to kid in those camp settings, which have done a remarkable job at keeping small cohorts, hand washing and mask coverings for certainly all the adults, if not all the children. So I'll be honest with you, I haven't heard of any kids getting sick in camps in the Bay Area, but those papers are being developed right now. When we look at the transmission in high-risk areas of kids in camps and in studies, probably the biggest comes out of New York City. You know, it was the epicenter in March and April, where we had almost 10,000 kids in the Ys of, all of these kids were essential worker children, so kind of a higher exposed rate of children. And in those communities, they had less than 1% of all of the adults in that in those camps became positive. And there was not spread within the camps themselves, and much less children became positive, and they don't think it was in the camp setting. And the similar things in Rhode Island on the East Coast when the outbreak happened. Now, there were a lot of camps in, for example, Texas, which I'm sure you heard of a couple of weeks ago, where there were some outbreaks. But again, there's Oregon and Florida, where you have a lot now some data starting to emerge from their public health systems about children positivity. And I think what that does is underscores a couple of concepts. One, that the prevalence of the disease in the area makes a difference for kid positive rates, and mostly adult behavior in the areas speak to how often kids are going to get it. So in Texas, for example, there wasn't physical distancing. There wasn't mask wearing that was strictly adhered to. So of course there's going to be positive cases. That's not what we're asking our schools to do here. That's not what we do in our camps here. And when we adhere to the pillars that we know work, rates are incredibly low.
Thank you. So I want to, looking at kind of the questions that came in, I want to approach a few of the questions in the chat before we move on, because I think they're kind of in the same vein. So, there's a few things in play here, and I just want to speak in very unexpertise ways of just my experience, having been in lots of conversations this week with other heads of school across the state of California, some that are on the watch list and some that aren't. The understanding from higher ed and more heads of school and also governmental connections through education is that the reason for telling schools to go to distance learning was to kind of shut it down. And now they're going to provide a waiver for those schools that say, oh, we can follow these guidelines, but with the understanding that most schools could not follow the guidelines, that there had not been the proper resources, money, time. We obviously didn't watch our schools double in size physically so that they could create cohorts of 10. And so it's easier to say, you cannot open school. And then if you can open school, I know that they're already starting to give waivers for childcare centers. There's a huge petition out of LA that came today for them to open up classes for special ed and for those small cohorts that actually can't receive education through distance learning. They may have one-on-one tutors. So it's going to start kind of reversing in some areas based on the waivers. With that said, we're in a very interesting situation on Thursday night at 8:45 that I logged into this Zoom tonight knowing, are we going to be put on the watch list pre the Zoom, post the Zoom tomorrow morning? I think there's a huge reality that San Mateo County splashed across every news that we are the only county not on a watch list is really obviously, I'm very aware of that, and that, we will likely have to really pivot. And so there's a couple things in play here. So there's the general feeling if every school around us outside of San Mateo County is not able to open the school, should we open the school if we are not on the watch list and by all intents and purposes can follow all of the CDC guidelines? The other question, I think, is that, is it safe to open our school if our local school district can't? I know it's a really weird feeling, and it's a really weird feeling for me too, to think, oh, I might be able to open like the only actual school in Half Moon Bay. But we have to remember that the reason the school is not open is because they can't follow the guidelines at this moment, not because it's unsafe. But I'd really like this panel's opinion on, are we fooling ourselves? Actually, are the rates drastically increasing? I haven't spoken to you guys since last Thursday. It feels like we're living in a different world. You know, what are kind of your thoughts and opinions around it? Maybe we should take the silence as a sign.
I agree with everything that you said, Lauren. I think that it's really, they shut it down because they know that in many schools, it's basically going to be impossible to follow the pillars and all of the requirements necessary. I think at Sea Crest, we're very fortunate to already have small cohorts and a lot of resource to make it happen in a safe way. I'm sure everybody on this panel would not be here if we didn't think that that could be accomplished. I would not, if I had a high school kid going to a high school, I might feel very differently than having elementary school kids, just because of how transmission works in younger children. And, you know, I don't know if you want me to talk about that at all, about why.
Yeah, you know, it actually goes right into a question that we had up here from Courtney about a new review that came out of China showing that the transmission rates in children ages 19 to 16 is a higher degree, but less in younger kids.
Yeah.
And I know that's like a big new question that we kind of all have. Of, you know, where actually is that point where it doesn't seem as putting safety into the best care based on the age of the child.
Yeah.
You want me to share the slide?
Yeah, can you do that again?
Yeah.
So the reason that kids, and in general, this is found to be true in many different studies across the world. You know, Iceland has some great data. The Dutch have some great data. A lot of conglomerate data out of Asia, even in the early days, show all this, that kids get it less often and less severe. And there is a scientific basis for that. And it has to do with how a virus gets into your body. And so how a virus gets into your body is that it actually has to attach to a certain protein called a receptor and then get in. And so that receptor for COVID-19 is called ACE2. And so if there's that receptor, then that virus can attach and get in. If there's not that receptor, it just can't get in. And so we know from many basic science work that actually children just don't have as much ACE2 receptor. So they can't get the virus in as readily as an adult does. And we have a lot of data showing basically this kind of stepwise approach that, you know, kids in the less than 5 have this much, and I could show you a graph, but it just basically goes in this stepwise increase where, you know, that 5 to 10, unfortunately, we don't have this nice breakdown of those middle schoolers, which we would all love to have, of that like 10 to 13. And then, you know, that 13 to 17 high school age. And then as we get above 18, then they become the adult range. And so even in the high schoolers, it's approaching adult receptor levels, but it's not quite that. But that's kind of the scientific basis of why kids just don't get it as much and they don't get as sick. And even when they do get symptoms, their viral load just isn't as high. So that's kind of the mechanism behind all of that. And so especially in an elementary school where, you know, people are so worried, well, how am I going to keep my 5-year-old from touching his best friend or whatever? It's like, we don't have to worry about it as much as I worry about high school kids touching their best friends. And so, you know, I think that, you know, as a parent with young children, I kind of take a lot of solace in this. And now that I kind of understand and trust the science that is behind it. I don't know if anybody else on the panel agrees with that data.
Yeah, I also read this article in JAMA, and I think it makes a lot of sense. It's very logical that there is less gene expression of this cell type, which the virus needs for cellular entry and for transmission. And then the studies also show that higher expression in the lower respiratory tract is associated with more severe disease. So yeah, I think when you really look at the science, I think it is reassuring. And I know that it maybe feels wrong. Like as a parent, you want to keep your kids in a bubble and protect them and do everything you can to prevent them from getting this virus. But I think we have to make our decisions based on data and facts, and everything you talked about, Lauren, with the pillars of safety protocols and preventing transmission. When those things are in place, we have shown that it really works. And that's been the case in our clinic. We've not had, in early March, we had a few patients come in positive, and then we implemented a lot of safety protocols. And so far, we've not had any transmission to staff or other patients.
And from a school perspective, as new studies and data and things change, we're really looking at we built out scenarios, and now we're building out more scenarios. So if we're put on the watch list and we ask for a waiver, do we want to focus our waiver on our youngest learners? As educators, we know that they are the least amount to transmit. Well, as scientists and doctors tell us, but as educators, we know they're the ones that are really going to have the hardest time with distance learning for multiple reasons, but that actual developmental age that they're at. And a lot of schools are looking at what would that scaffolded model look like to come back in, whether you're on the watch list or at some point, most of these California schools, fingers crossed, over the course of the year, will get lifted off the watch list. And all of these schools that are private schools or smaller schools or public schools that maybe are able to start putting these practices and the hybrids in place are going to start opening. So while we all may be starting in distance learning, the opening is always going to be the goal for every school at some point in the school year. I think no educator and no administrator is resolved that I want to lead my school through distance learning for an entire school year. So we're really trying to monitor if and when it is safe, what would that look like? And so a lot of schools are talking about, and we're really exploring, if we were to open back up after being closed, do we want to start with our youngest learners and then scaffold up from there and look at very different opportunities for our older learners to come to maybe do their learning at home, their core educational learning, and then come together only for outside activities where we know that the transmission rate is so lower. So distance socially, being able to do science outside for a day or have a different experience based on these kind of studies coming out. But the difficult thing is right now, our best bet, and what this panel has told me, my best bet, because I'm not a doctor to make these decisions, is to follow the guidelines. So currently we are able to kind of follow the guidelines. A couple other questions that popped up. So there's a lot of questions about testing, and I realized I totally just skipped over that whole thing. So the big question about testing, and I know that frequent testing can be really good, but then I know that it's really hard to get frequent testing. I know that you can get tested one day and come up negative and then get COVID the next day. So thoughts in general around testing, and then we can talk more specifically. There was quite a few questions on testing in kids versus adults, and I can talk a little bit more about our thoughts behind testing at school. But first to the panel, general questions about testing.
Hannah, I'm not sure what Stanford does, but I know that we don't trust any of the what we call instant tests. So anything less than an hour, any test or any, there's some private companies out there that say that they can, give you a thing that'll test it, in your home and all that kind of stuff. We don't trust that testing. So any of the instant tests, we don't trust. It's a high false negative, meaning that if you get a negative result, you don't know that it's actually a true negative. We trust the nasal swab PCR test. And so that is literally a swab that feels like it's touching your brain. It is not a fun test to get. And we trust it very much in the sense that if you get a negative, we trust that it's a true negative. And so it's a low false negative rate. We consider that a true test for about 72 to 96 hours. So I would consider somebody getting that test, walking around in life, for it to be true for, let's say, 4 days. So it's not a reasonable thing to test every child in Sea Crest or every teacher in Sea Crest every 4 days. It's not something that you want to have to do that often, nor is it something that's going to be high yield. The asymptomatic rate, positive rate, is still very low. It hovers, about 1% or so. It's getting a little bit higher because we're testing more broadly now, but it's still very low. And so that's why symptom screening is really important. So I will urge all parents, even though before we used to send our kids to school with a little Tylenol if they were feeling warm the night before, I will urge you to not do that anymore. You have to be responsible for our entire community and keep them home, and get tested if you think that they have the sniffles or a fever. And that would be appropriate use of testing. Antibody testing is not valid in the general community. So I know there's talk of that out there, but it's not something that is used to call somebody a positive. It's used in very rare clinical situations.
And I guess a follow-up question is, we have a visitor. A follow-up question I have are thoughts on, the panelists provide their thoughts on current, I'm sorry, that's not the question I wanted. I lost it. It was something about, sorry, I lost it in the,
Lauren, while you're looking at that, this is Keely. Can I just say a real quick thing?
please.
I just want to say, as a Sea Crest parent for 17 years, I have a lot of faith in this community that we will have the grace to support each other in the decisions that we make. And I really, really encourage every family to not only make a decision about what your family is going to do, but really very child-centric. And we have 3 kids. I have 3 biological kids. 2 of my kids are going back to school. One of them is going to do distance learning. So we made a decision based on physical safety, mental, social, emotional safety, learning styles, and age. Those were the things that we looked at when we made our decision. And so, one, I really, really hope that everyone can think about each individual, right? You know your child best. So think about your individual child's needs. And then 2, I really hope that we can, as a community, which has been my experience in this community for 17 years, can really support each other through whatever decision is made.
Thank you. I didn't find the question, but I guess, we have been offered through a parent that works at a company that does do the nasal swab, the difficult testing, to have testing available for our faculty. They want it for peace of mind. It will not be every 4 days. And so there is going to be that risk. They won't want to do it for every 4 days. Let's just be honest, once they have it, but they have offered to provide that for us with a nurse that will administer it. So when we're looking to go back to school, whether it's in a few weeks or after we've been in distance learning for a while, we will be able to test our teaching community to give a peace of mind for themselves and a peace of mind for our community. And we will do frequent tests, especially after if there is a prolonged break and our community isn't together. So we will have that, but that, as Roxana said, that doesn't mean that like we're in a safety zone, and there's no way we would be able to administer tests every 4 days. That just wouldn't be something that we would be feasible to do. I really want to be mindful of time right now, and I know that there are some more questions. There's questions about cohort size, our average cohort size. Actually, our largest cohort size we're looking at would anticipate to be 12, but I can speak to that in just a moment. I really am thankful that Keely brought that up. I want to kind of connect what Keely said back to something that Roxana said, that what we know is that kids don't really transmit it, but what we know is that adults do. I have been asked by a lot of you if we will monitor your behavior, basically, to put it bluntly. We are looking at like a good faith kind of contract that would mean like we're all really trying to create a safe space for our kids to come back to school, even if we're talking in the spring and it really depends on our behavior. But I can envision calls and emails that I would get if people choose not to do that. I'm not going to monitor behavior outside of the school day. I can monitor from like the moment the kids get to campus and focus my energy on creating that as safe as I can for the kids and the students and the teachers till when they leave. And so it really is that communal effort that we all have to have to decide how much what's going to happen. I mean, San Mateo County knows right now we're on the pre-watch list, right? We know, where our behavior lies, what's going to happen. And we all also know what we have to do to get it to go back down. We lived it. We watched this happen in New York. We know that it's really important for us to stay home and shelter in place and really be mindful of our distance and those pillars when areas get really impacted. But thinking about opening schools, I'm not as worried about the kids. I have to tell you, the one thing I know is that we know how to get kids safely in school. You entrust us, whether there's going to be an earthquake or a fire drill, to teach them to read, to write, to learn, to do monumental things over the course of the year. So keeping them in a mask or keeping them social distance, will it be hard? Sure. But we teach them to tell time and tie their shoe. So like we teach them things, but what our community as a whole decides to do outside of that is what will really impact where we are able to eventually open up and how safe we are able to make it. There are a lot of other questions. I don't want to talk too much about the waiver process until we're there. I want us to wait. I also have a few really good colleagues that are in LA and San Diego that are going through the process right now. So I will have a lot more insight to what that looks like. They don't have the waiver for San Mateo really laid out yet. They have an outline because we don't need it yet. So I don't want to jump put the cart before the horse before that. So just to kind of be mindful of everyone's time, I know that there will be lots of other questions that everyone has. And I really encourage you, if there is something that you're like, God, they didn't answer this, please email me. I will send it to this committee. This committee has so graciously, after their very long shifts every day, given us the gift of their time and their patience and their knowledge. And the greatest gift to me is they're a sounding board that I get to text or call and say, gosh, what do you think? Because this is really uncharted territory. So if you have really a burning question, please let me know and we will address it as the committee. So I really, really want to thank everyone for their time. I have a few things. So I want to address that I realize that a lot of our focus has been on opening up school. And I've heard from a lot of you that we are about to ask people to choose, and it's really been on that. I purposefully did that, not because I want everyone to come to school and that's my personal agenda, but because I looked at coming and that I had 2 months of of being at Sea Crest before we opened, and I know how to run a school in normal time, and I know how to run a school, and Sea Crest knows how to run a school distant. But what the unknown is how do we open a school under these guidelines? And so I chose to spend the first month focused on how do we open a school if and when we can in a completely unknown. I've never had conversations about kids sitting 6 feet apart, about the specific kind of cleaning materials, about bathrooms and cohorts and pods, and the safety regulations around HR with your employees and keeping them safe. So yes, you're absolutely right to mention that that has been the focus. That does not mean that the staff and the administrators haven't been thinking about all of the distance learning that happened in the spring that is known. They sent out a survey, what went well, what didn't went well. They kind of knew. They didn't need a survey. They were in those Zoom classrooms with your kids. They know when it fell. They know when they had successes. And they've been continually monitoring how to approach kids via Zoom. What is the appropriate time distance for a lesson to happen? How do we teach kids that are young on Zoom versus kids that are older? So those conversations have been happening, but I haven't had to skill myself or you as a community as what that looks like. We have a really good sneak peek because we lived in distance learning for a little while. But I do hear that you want to know more about what the program will look like. And I've talked a little bit about this chicken and egg, and it's not like a political tactic to get around it. So I do want to address more of what it will look like, knowing that we have built out scenarios based on how many kids. And that's just the reality we live in. If we have 15% distance learning, they may be a multi-level cohort that zoom into different lessons that are live. We want to make sure that they have connectivity with their class every day. If we have 50% of the school and there's, for example, 2 separate 6th grades or 2 separate 1st grades, each with a teacher running completely, there won't be the need to cross in between what's happening in school and what's happening at home. They can run differently. And so the reason I've been hesitant to lay out a detailed plan is because a lot of it fluctuates based on how many kids. But what I do hear is that we haven't provided quite enough with asking in the survey. So here's what's going to happen. So we've heard you and we're responding to that. So Michelle and Holly and I have been working this week all about how we articulate and really show you our vision for distance learning in the various scenarios. But really you want to know that your kid is not just being plugged into a laundry list of services that you could just go pay for Khan Academy yourself. I totally get that. And so the survey will come out tomorrow because we already articulated that it will come out tomorrow. A slight change is we've also heard you, and I have felt this. It is really hard to make a year-long decision. I can hardly commit to if I want to go to the grocery store tomorrow. I completely understand, and these are our kids. So when you see the survey tomorrow, there's going to be 3 choices. 1, I would like to come to school or have my child come to school if it is safe and possible for the school year, if that's an option. 2, no matter what, I think we're going to go with distance learning for this year. And now we have a 3rd option. For the first trimester, we would like to do distance learning. Cases are rising. California is across all of the national news, but I would like at the end of that trimester to reevaluate and opt in for in-person learning once I feel more comfortable. So we want to provide you that 3rd option. If I could provide you 8 options, I would, but the reality is we have teachers we're trying to hire and desks we're trying to set up. We have to kind of know. I also know that there is a very likely chance that the moment we push send on this survey, the County of San Mateo is going to put us on a watch list, essentially saying, you can't open school, Lauren. Really great timing. We still need this data because at some point we will be off a watch list, right? I don't know when that is, but at some point in this school year, that is the hope, we will be off a watch list, and we will need to be as prepared as possible. The more preparation we can do in the summer when we are not actively teaching your kids in the classroom, the better all of those scenarios will be when and if we have to make an adjustment during the school year. And we want it to be as seamless as possible. That said, the survey will drop tomorrow, but it's not due till Monday. And in Sunday's Wave, both Michelle and Holly are making a robust video with details about distance learning. So don't feel like you have to answer. If you know right away, you can answer. But in Sunday's Wave, there will be a lot more information about distance learning. I 100% mean this. If at any point you say, I cannot make this decision, just reach out to us. Michelle, Holly, and myself, we want to walk you through your concerns, answer as many questions as we can. But unfortunately, we've reached that pass where we have to know so we can get your teachers going. They've been planning distance learning, they've been planning in-person learning, but they want their class lists. They want to send your kids postcards. They want to plan, and they can't until we decide. So while it's a really hard time to decide, that is what we are going to ask. Lastly, as plans for the school year start falling into place, we all know meeting everyone's wants and desires is literally impossible. It's not my wants and desires. It's kind of the reality we are in. We're all coming to this school year with different places and having different life experience with different concerns and worries, and people in our life that may be immune compromised. They may be in our homes. They may just be a mother we want to visit all the time. And that fills us more socially and emotionally that it's not worth the risk. And while you personally may not agree or approve with the decisions that have been made or are still yet to be made, I really implore you to come together and let's work as a community to get this to work. It's a really hard decision to send your child to school in a pandemic. It is equally a really hard decision to have your child stay home and do distance learning ever, but especially in a pandemic. It is a really hard decision to open a school or not in a pandemic. It is a really hard decision for teachers to choose to come to school and teach kids in a pandemic. I'm asking us all to be kind and show grace and understanding towards these really hard decisions that everyone is making. And remember that our decisions as a school is to do what's best for the collective good. So while it can be hard and frustrating to have choices, we're trying to make the hard decision for the families that this may be the only option for childcare, and they need it. While this may be what they need is a robust distance learning because they have a immune compromise. But equally as important, people that just don't feel comfortable or feel really comfortable or can't be in their house with their kids. Everyone's hard decision that they have to make. I can't emphasize this enough. Your child's experience this school year depends largely on how they perceive you think it's going to go. I'm going to repeat that. Your child's experience this year is going to depend largely, if not solely, because we aren't most likely going to have all of them, on how you perceive this year is going to go or is going. So please do things like set them up for emotional success. Have real, honest conversations about how school's going to look this year, whether it's in person or different. Let them be upset. If they're middle schoolers, they're not having dances. Let them grieve that now. Be honest about the experience that we're all in. Help them adjust their expectations And while we're doing that, we as parents that want the best for our kids, we need to adjust the expectations. It is okay for us to all mourn that this is not going to be the school year any of us want, whether we are a parent, a teacher, a student. And we need to open and honestly have those conversations with our kids, but readjust our dialogue and our expectations them. Remind them daily that they are safe and that they are loved, and Sea Crest is their school, and that it's their community, and that it will be their community, whether it's distance, whether it's in person, and when we are done with COVID. And most importantly, and this is kind of a mantra that I'm repeating daily, is let's remember that this way of doing things is not forever. This is this moment in time. But for right now, it is. This is it. And it's really, really hard. And making this decision for your child and making this decision for a school is really, really hard. So we need to acknowledge it and move forward the best we can. I want to remind you that your kids are so resilient. We are so resilient. And I promise we can do this together. But so much of what is going to happen and play out in the next few weeks is going to be guided by the conversations and the attitudes we share with our kids. I always remind parents, they're always listening. They're always listening. So your frustration with the school or the decision or distance learning or in-person learning, they may be picking up that you're unhappy, and they're already deciding that they're unhappy. We can't work against that. We need to muster as much fake enthusiasm as we can as we launch this year for our kids and for the community. So with that, I'm sorry we ran over in time, but the survey will come out tomorrow. There'll be a brief note about it. If you are ready to fill it out, please do. If you are not, there will be more information on Sunday, and please read that. If you are still not comfortable, you just reach out to myself, to Michelle and Holly, and we want to walk you through as best we can this process. Following the next week, once we start having numbers in of where people are deciding, we will kind of start talking more detail. Always know we're completely aware that at any moment we may be put on that watch list, which means we are mandated to start distance learning. We can apply for the waiver. We don't know what that process is. We may also be in a situation where we get put on a watch list and off a watch list between now and the start of school. So that ultimate grace and flexibility is something that we are going in with every single day. So with that, thank you so much for tuning in. This is going to be recorded. If you noticed a friend that likes to group text to your friends, and they had lots of questions and they're not in this panel, you could forward them the link and say, oh, they talked about this, because that would be really helpful. The more we hear details and we help share those details out is amazing. So thank you to our panelists so much. Thank you to our parents that gave up their Thursday evening, and stay safe, everyone. We will be in contact, and we'll talk to you soon.